Conversations around mental health are important to have in any community, but during the month of July, the spotlight is on people of color. July is known as the B.B. Moore Campbell National Minority Mental Health Awareness Month. B.B. Moore Campbell was an American journalist, teacher, and mental health advocate. For years, she fought for equitable mental health care, especially for African American communities, up until her death in 2006 at just 56 years old. A bipartisan motion in Congress formally dedicated the month to her and her advocacy for people of color on June 2, 2008, to raise awareness on the unique struggles and experiences underrepresented communities face in the mental health system. According to Mental Health America, 13% of Asian Americans or Pacific Islanders live with a mental illness. That number is a little higher for the Hispanic community at 15% and 17% for African Americans. Indigenous communities are at an even higher risk, with reports showing 23% have a mental illness. They are also the most likely group to test positive for bipolar disorder and PTSD.
We know that there's just not as many opportunities for people to receive treatment. So National Awareness Months like this one is really important because it gives us a chance to raise awareness of the importance of getting mental health treatment.
Helping all people, no matter who they are or where they're from, all starts from within the industry. Bain Froney introduces us to local healthcare professionals who say diversity can help end the stigma in those communities.
If you're not mentally well, there's no way the rest of you can be well. In our Black and Hispanic communities and other BIPOC communities, we know that there's just not as many opportunities for people to receive treatment.
On top of not a lot of resources, those in the BIPOC communities also tend to not reach out for help due to their culture.
You know, a lot of cultures, they think they need to fix within, and it's hard. They don't go to strangers for help. They don't ask for help from other people. They fix within their family. They fix within themselves.
And one way to make those within the Black or Hispanic communities feel more comfortable opening up is having a diverse workforce within the mental health field.
That people that look like you and that represent you in other ways, other than gender, can really connect with you on a very personal level.
According to the American Psychological Association, in 2019, 83% of the psychology workforce is white. 7% of the workforce were represented by the Hispanic community, 4% Asian, and 3% African American.
My lived experience as a Black American woman is going to be very different than the lived experience of a white American woman. So it's really important to make sure there's some representation.
We have gotten better. I would say, you know, we're seeing more counselors that are men, that are Black, that are Indigenous people, that are people of color. We're seeing more of that now, which is really, really important. But it's still not where we need it to be, where we want it to be.
And part of that push for diversity starts with the younger generation, as health professionals are pushing people of all backgrounds and cultures to explore different areas of health.
We really want to make sure that young people that are going into healthcare explore all options of healthcare, all practices of healthcare.
So while there has been improvement when it comes to diversity in the mental health industry, more representation could mean saving more lives.
Finding people of color in mental health professions can be a challenge, but it's also what inspired one Waco woman to start her own practice and help others just like her.
When I was a little girl, I needed somebody to talk to.
Sharon Miles decided at a young age she wanted to become a therapist, to offer others the help she once needed herself.
It's the only career I've ever considered, and so once I figured out what a therapist was, that's what I worked towards being.
She now owns Milestone Psychotherapy and works to break the stigma around mental health care.
Your mental health means everything. If your mental health is not functioning correctly, it can have effects. It can affect your body. It can affect your brain. It can affect your relationships. Mental health is the stem of it all.
It's been awesome, almost life-changing.
Tanika Jones is just one of the many people Miles has been able to help through the years. They met after Jones lost a close friend. She says working with Miles has really changed her life.
It did start out as grief counseling, but it has turned into just a real evolution of who I am and what I aspire to be. So, you know, I started discussing with her goals that I have for my life and just for me as a person, and we've been working through those.
Jones says when looking for a therapist, she specifically wanted someone with her shared experience.
I knew that I needed help, and I knew that I needed to talk to somebody, but I did want it to be somebody that could relate to me on all aspects of who I am as far as my culture. my gender as well, because she's a female, and as well as my color.
95% of my clientele are people of color.
Miles says the mindset is not uncommon, as many are less likely to open up to people they don't think will understand them.
Being Black, Indigenous, person of color, most of your life is what will people think. Although many of us would say, no, that's not how we're thinking, and we're not choosing to consider someone else's opinions. What matters most is our own culture's opinion, our own ethnicity's opinion.
The fear of judgment is just one reason people might not consider therapy. Miles says others include pride, as many don't want to come across as weak. Another being a strong dependence on religion in minority communities, leaving people trying to pray away mental health troubles.
Mental health is just stigmatized so much. Still today, there are children who will ask their parents, can they come to therapy? Can they talk to a therapist? And then because the parents don't believe in it, the child doesn't get help.
Miles now hopes to help break that stigma through her work and sharing her own story. If you're one of the many people struggling with their mental health, you are not alone, and help is just a phone call away. Any of those numbers on your screen can get you connected with both local and national resources. You can also now text the suicide hotline at their new number, 988. We will return on August 9th with an open conversation around the impact social media has on mental health, and we want you to be a part of the story. Share your story with us to our email or our Open Conversation Facebook page.